Hi, I'm Dr. Salil Kandwala, and I'm the medical director at Advanced Urogynecology of Michigan. Today, we'll discuss this very common problem of stress urinary incontinence, or SUI. It is essentially uncontrolled leakage of urine that happens with any strenuous activities. In the UK, it's called effort incontinence. So, any effort, coughing, sneezing, laughing, lifting, in the absence of a bladder contraction. So let us review the typical female anatomy. This is the head end, this is the foot end, this is the front, this is the back. This is where the pubic hair would be, and here is the pubic bone. The bladder resides behind that, and the bladder essentially is the storage organ for the urine as it comes from the kidneys. The urethra is the tube that brings the urine to the outside. Behind that is the vagina, uterus on top, and the rectum at the back. The pelvic muscles and the urethral sphincter keep that urethra well supported. The bladder is filling up with urine from the kidneys, and as it fills up, you can see that the internal sphincter and the external sphincter of the urethra keep it tightly closed. The only time it opens up is when you want to urinate. So now it opens. That's a classic mechanism. However, if the muscle and the ligaments have weakened, then you can get stress incontinence. So typically the dotted line is where the bladder is at rest, and as is the urethra, and it should remain there. It should not fall back. However, with coughing, it doesn't stay there. If the muscles have weakened, it'll fall back, funneling open, resulting in urine leakage. That is classic stress incontinence. So as you can see here, the urethra is straight. When she's coughing, it falls back, and that's when it loses its strength and it causes leakage. Now, in some cases, the urethral sphincter that I showed you, that itself may be weak. So this is a normal sphincter, and here you can see weakness where it's gaping open. And that can also contribute to stress incontinence, which is very common. 1 in 3 women have leakage. And remember, this is a problem of young women, the 30s and the 40s and the 50s, who are jumping, who are doing kickboxing. It's not typically a problem of the elderly, but it can happen at any age. So the first step is for you to complete the history forms, and please complete the forms completely. The validated questionnaires are very important. The MESA questionnaire helps us differentiate the stress from urge. I have described this at length in my introductory video that you should have watched. Then these are the other questionnaires. The sexual function questionnaire is invaluable because a lot of women with incontinence are also leaking during sex, and that affects their sexual function. Then when you come into the office, we'll review the history form and completely, including your goals, and then do the examination in the lying down, maybe standing cough test, then do the urodynamic testing, which is very important. It just takes a few minutes to do it. It's done in the standing position, but as I mentioned in my introductory video, it is like a EKG test of the bladder, and that will help us understand when do you leak, how often do you leak, and at what bladder volumes do you leak. It also tells us how strong that urethra is. So it's a good correlation with your history. So especially if it's mixed incontinence, there's some urgency, some stress, then this is very important to identify what is what. We may also look into the bladder, which is a very simple test. You're watching as we're looking in. It's completely done awake, takes a few seconds to do it. Typically for irritative bladder symptoms, or especially in a smoker, and especially if there's blood in the urine or previous surgery. Bottom line, stress urinary incontinence is a very common problem. The treatment has improved dramatically. My procedure that I have perfected and patented, called the DISC procedure, has almost 100% cure, not improvement, cure. It's done under local anesthesia with minimal downtime. And you will hear about that after the visit with me. So at this moment, please watch our introduction videos. We'll talk about who we are, the different pelvic floor conditions, because you may have some other condition too. The value of the history forms, why should you complete them, what are examinations all about, and the testing. Your initial visit also will explain to you how it will unfold, and then our policies. Very helpful for you to understand your own care. Finally, please MyChart us when you have reviewed the introductory videos and you've completed the history forms, and also confirm your appointment date and time. When you do that, those three things: watch those videos including this video. Number two, completed your history forms. And number three, confirm your appointment date and time. That's when your appointment will convert from a tentative to definitive. Now, in case you don't have my chart, then you can call the office and just let them know that you've done that. So I look forward to taking care of you. And the good news is that even if you have stress incontinence, a whole lot can be done about it in a very simple manner. See you soon. Take care.